Hello and welcome to COVID Conversations here on WNCU 90.7 FM. We're streaming on YouTube, Facebook, and Instagram. I'm your host, Kimberley Pierce Cartwright. I'm the News and Public Affairs Director here at WNCU 90.7 FM. The COVID-19 pandemic has affected just about every aspect of our life, including screening, diagnosis, treatment, and follow-up care for cancer. Dr. Susan Dent is here with me today to talk about breast cancer and COVID. She's a medical oncologist specializing in breast cancer. Welcome, Dr. Dent.
Thank you.
Yes, great to have you here.
Thank you for having me.
You're welcome. So let's get to the first question. What were your patients' biggest concerns going through cancer treatment during the pandemic? And some of that might spill over to now.
Sure. I think their biggest concern was their safety of continuing to receive treatment. First of all, coming into a hospital at the height of COVID was a scary thing to do because we were saying, the message was getting out there, stay away if you're not sick. So just coming to the center was concerning, some of my patients. Were they going to get COVID if they came here, and how would that affect them? And then how was the treatment going to affect them? Was it going to put them at higher risk? There was many unknowns, and I think the things were changing so rapidly that getting the correct information out to individuals, including those faced with undergoing cancer treatment, was really challenging.
Yeah. So it was challenging. So how did you as a doctor feel working with patients who had to postpone their care?
Yeah, I think we really tried to encourage those patients that needed care not to postpone it. I think it was important to realize that when you're treating someone, let's say with early stage breast cancer, it's important to continue your treatment and to get it in on time. The rules around, being safe and coming to this cancer center and getting your treatment really were safety practice rules that were implemented for everybody, right? So, wearing a mask, social distancing and so on. We implemented policies to make people feel safe so that when they came to the cancer center, they felt that they were safe getting their treatment. So I think one of the misconceptions that we tried to dispel was it wasn't safe to continue treatment. I would argue that, continuing your treatment and finishing your treatment was the better thing to do, and to try, because ultimately, right, we're trying to ensure for these women their cancer doesn't come back. So stopping their treatment in the middle of a planned treatment is not good, would not be good for an individual.
So can you talk to me about the different stages of breast cancer, just so people will be clear what people have to go through when they have to make decisions about their
Right.
care?
Sure, that's a very good question. So, at the very earliest form, some women have what is called ductal carcinoma in situ or lobular carcinoma in situ. This is actually a precancerous diagnosis where you have cancer cells that remain within a duct. They haven't kind of broken open beyond this membrane. And those people often will go for surgery and or radiation, but do not need traditional chemotherapy treatment. Then very early stage breast cancer is when the breast tumor is confined to the breast. That's the earliest form. And that's often treated with a lumpectomy, removal of that section of the breast tissue, and a sampling of the lymph nodes. Then, if the breast cancer is in a later stage, it can spread to the lymph nodes under the arm. That's the first area where breast cancer tends to go. And then, unfortunately, if it continues beyond that, we can see women where the cancer has spread into other organs in their body. The most common being lung, liver, and a bone. And so that's what we call advanced or metastatic breast cancer. So there's a wide range of stages of breast cancer depending on, where that cancer is at that point in time for that individual.
Um, I want to know if COVID-19 affects mammogram results. When people go in and they get their annual checkup, what could COVID possibly do in that situation?
Well, in fact, again, this was a large learning curve for healthcare professionals because we didn't really understand anything about this new virus, COVID-19. But what we did appreciate, began appreciating, is that the one thing it did is affect mammograms. The vaccine did. So what was happening is that women were going and having their COVID vaccine shot, and then they were getting a mammogram a few weeks later. And what was interesting is that we were picking up these enlarged lymph nodes under the arm, and all of a sudden everyone became really concerned that, we were seeing these women that had breast cancer, when in fact what we learned is that that lymph node under the arm was in fact a reaction to the vaccine. So, the lymph nodes sort of help the body clear infections. They get enlarged with any inflammatory conditions. So it wasn't breast cancer, it was an impact of the vaccine. So moving forward, what we tried to do was to educate women that if you've had the COVID vaccine shot within the last few weeks, that's not a good time to be having your mammogram. So that
So
was one of the biggest lessons that we learned. And it was really by our radiologists just noticing that they were seeing all these nodes in women, and then realizing it's the vaccine, it's not cancer.
wow, that is a great discovery, and then you know how to react to that if you see people who have the larger lymph nodes. So I want to talk about cancer survivors. So they've been through their treatment, and they're sailing along, and then here comes COVID-19. Are cancer survivors at greater risk for COVID-19?
I don't believe cancer survivors are at greater risk of COVID-19. I think the same risk factors apply, particularly those people who have completed their cancer therapy for early stage disease, where the one caveat I would say is for those women who are living with more advanced disease, who are ill from their disease, and whose immune system may be suppressed from ongoing therapy for that disease, those people would be at increased risk. So as we've learned, anyone who has chronic underlying conditions can be at increased risk. And I would say having more advanced disease and being on chronic cancer therapy certainly would fall within that group of sort of underlying medical conditions. So that group would be at increased risk.
So when you're talking about chronic conditions, are you talking about other than breast cancer, like heart disease
Absolutely.
or
Heart
yeah?
disease, hypertension, diabetes. And, often it's not just one thing, right? So within that individual, you can have someone who has underlying breast cancer, but then they could also have diabetes, hypertension. So it's not always one thing, but it's the combination of all those things that places that individual at increased risk.
Okay. Um, can having COVID-19 promote breast cancer reactivation, increasing the risk for cancers to return? And that's just the thing in the back of our minds when we're thinking about our cancer. Is it gonna come back? How do
Yeah,
we plan and live our lives under
right.
that that notion?
The greatest fear my patients have is, of course, cancer coming back. And, I would have to say, as I answer this many times for other issues, is that no, having the COVID vaccine won't make it come back. Having COVID-19 itself, it won't make it come back any quicker. There's no evidence to suggest that. I mean, this is, a virus that goes through our body. We deal with it. Hopefully we get better from it, but it does not lead to an increased risk of reactivating the breast cancer.
So we're coming in up into like the fall season, and usually we're encouraged to get a flu shot. What are you telling people about getting their booster shots for COVID-19 when they talk to you about that?
Absolutely. I encourage people to get their flu shot, first of all, and I encourage all my patients to get their booster shot because, we're all at risk. Whether you have breast cancer or not, we're all at risk. If you have breast cancer, you happen to be going through treatment, you might be at slightly higher risk, but why place yourself at greater risk of getting COVID-19 if you don't have to? In particular, because while we know that people who are vaccinated and who are otherwise healthy do pretty well, we've also heard of stories, right, of people who don't have a lot of underlying medical conditions who can get really ill. And the other thing I'm concerned about is we still have a lot to learn about so-called long COVID. We're seeing now that those patients who have COVID have memory issues, they can have longstanding heart issues. So I think there's still a lot we have to learn about the consequences of having COVID. So I would say have your shot because you do not want to get COVID if you can avoid it.
So are you doing different messaging to people who have breast cancer about COVID-19, about like possible variants? So what are you talking to people about when they're looking down the road about their care?
We certainly encourage them to have their COVID shot. So when patients come into our clinic, we actually record that in their electronic medical record, whether they've had their COVID shot or their booster. We keep track of that electronically, and our nurse practitioners certainly speak to our patient population as well to try and encourage they get their shots. I've had a number of my patients who have had COVID, and fortunately, they've all done pretty well, but I know that that's not the case for everybody. So my feeling is you're dealing with breast cancer. That's enough to deal with. Let's try and keep you as safe as possible and avoid getting COVID because we can talk about what in the general population, we can talk about what we know in the literature, but as an individual person, I can't tell you how sick or not sick you're going to get. And I think that's the thing that concerns me. So why add something else onto, you're already dealing with breast cancer. Why add something else onto that? And I'm concerned because I think there's a lot we don't know. And as more variants come out, we don't know the impact of those variants on individuals.
Okay. So how looking into the future, if you have your crystal ball your crystal ball handy, how will COVID-19 impact breast cancer diagnosis and care as we move into the future?
So I think what COVID-19 has done, unfortunately, and we do have literature on this now, is I'm now seeing patients who did not have their regular screening mammograms. And so we're seeing individuals come to us at a later stage in their disease course. So rather than picking up that breast cancer when it was a very small breast cancer, we're seeing women come in who now have nodes involved. And I've seen literature on this in the US. I've also seen literature on this in Canada. So that's really unfortunate. I think moving forward, we have to tell women, despite COVID is here to stay, it's not going away, that it's very, very important that you continue and keep up with your screening mammograms, that you do not need to cancel it, delay it, put it off. But that I think is the real thing that COVID did. And it was a big disservice, of course, for our population. And we did slow down in doing mammograms here for a while at Duke, but that was for a matter of months. We're up and running again. Women can certainly come in and get their mammograms, but that's how I think it has changed things. And if we have another surge, I would be worried that that's how it could impact breast cancer in the future, because the best way to deal with breast cancer is to pick it up early.
So is that what you've learned? And then maybe you could give a takeaway for people who are very, very concerned about their future with cancer.
I think my big takeaway is be aware of your breast health. Keep up your screening. Don't delay it because of COVID. And should you happen to have an abnormal test or it turns out you do have breast cancer, please don't be hesitant to reach out to your healthcare provider and come and start your treatment. And I've learned over the last more than 2 years now, we've managed to get, all my patients through their treatment, and they've not, been admitted because of undue consequences from COVID. So don't delay, because the worst thing you can do is put off your health.
Okay. Dr. Susan Dent is a medical oncologist specializing in breast cancer, and you're over at Duke right here in Durham, North Carolina. I want to thank you very much for your time, Dr. Dent, and being with me. I know that you're probably busier than ever over at the hospital.
Well, thank you very much. And I really enjoyed the opportunity to speak with you today.
Yes, we always want to spread the word about COVID in any way that we can. So your help has been tremendous for us today.
Thank you.
You're welcome. And thank you, audience. We want you to continue to watch us on YouTube, Pick us up on Facebook and Instagram, as well as listening on WNCU 90.7 FM. We want you to like us. We want you to follow us. And of course, we want you to subscribe to our pages to see more of our archived shows. I'm Kimberly Pierce Cartwright, your host for COVID Conversations. And we thank you, as always, for tuning in.